I don't know if when I do that, if you guys can hear me or not, so I don't want to do that. If you are having any issues, please someone send me a text and let me know what it sounds like. But I'm going to move forward and just turn my volume down as not to confuse myself. So today we're going to have a conversation about COVID-19. I know that, of course, this is a topic that's very important to everyone. It is a pandemic that we're all experiencing currently. If you are in Jersey City, then you know that we have two testing sites. 1 second, someone told me to close the Facebook Live, but I'm not sure how that works. And this is my first webinar, so bear with me a second while we get set up, because I want to make sure that this broadcast is good and that everybody's getting the information that they need. Okay, now I'm back to the Zoom. 1 second. Okay, now I'm back to the Zoom. Okay. And it still says live on Facebook. Okay, I think we're good now. So if we are not, then Lorenzo, send me another text message. But I believe we are good now. I am looking at it on my other laptop. So once again, Councilwoman Denise Ridley, we're here to discuss COVID-19. Thank you to everybody that's joining in. We know that COVID-19 is a big deal here in Jersey City and throughout the world right now. So I wanted to make sure that you had an opportunity to hear from some doctors that are dealing with this COVID-19 situation every day. I also wanted to take some time to address the issue of COVID-19 in the African American community. I know that that has been of concern recently, especially on a broader scale with the recent statements that were made by the Surgeon General publicly, which I think was great that he did do that publicly to bring awareness to the situation. So I know that that's a hot topic at the moment. And we have some experts here today that are more than able, willing, and eager to discuss that topic and that are ready to share their insight with you. So let's just hop right into it. First, let me just do a few housekeeping things. If you are in Jersey City, please be aware that we do have two testing sites. I think that most people know that by now because they've been running for weeks at this point. There is a testing site at the old DPW facility, Department of Public Works, on Route 440. That is a drive-up site. Then there is also a walk-up site that has been on Marion Boulevard across from Newport Center Mall. That site has now rotated to the Bethune Center. That site is at the Bethune Center today, but you must call and make an appointment. If you scroll through my Facebook page, you will see the flyer. I will repost it again, just to make sure you have all the information. But we do have two testing locations for Jersey City residents. You must be a Jersey City resident. And please know that if you need any information at the state level, there is information on the state's website, nj.gov. As soon as you go there, there's banners for COVID-19. If you need any information from the city, as soon as you pull up the city's website, there's a separate tab for COVID-19. All the information is there. If you have any questions, feel free to send me an email, dridley@jcnj.org, dridley@jcnj.org. My office is up and running. We're working every day, so feel free to reach out. Okay, so let's get into it. So I have a great panel for you today, and I'm going to ask each of them to take a few minutes to introduce themselves, and I'll just run through their names very quickly, and then we'll circle back to the top. So we have Dr. Ebony Hilton, we have Dr. Rashonda Mitchell, we have Dr. Essien, I said it right this time. We have Dr. Bell, and we also have Reginald Swift. So we're going to start with Dr. Hilton, and then we'll move on. And I'm going to ask each of them to take about 30 seconds and give us a brief bio. Dr. Hilton.
Right. Thank you for that, Congresswoman Ridley. So my name is Ebony Jade Hilton. I'm a critical care anesthesiologist, which means I do 30% in the ICU and the remainder of the time in the operating room, and the medical director of Gustot Consulting. So thank you for having us.
Thank you. Dr. Mitchell.
Hi, my name is Dr. Rashonda Mitchell. I am, guess I finished in obstetrics and gynecology, so that's what I do as far as my specialty. And then I decided to specialize further and do high-risk obstetrics. So I deal with maternal fetal medicine, which are complicated pregnancies. So,
awesome, Dr. Essien.
Hey, good afternoon, everyone. My name is Utibe Essien. I'm an assistant professor of medicine at the University of Pittsburgh. I'm a primary care trained physician and a health disparities researcher here at the university.
Nice. Dr. Bell.
Everyone, nice to be with you all. My name is Tyson Bell. I'm an assistant professor at the University of Virginia, where I practice critical care, infectious disease. I'm also the medical director of the ICU, one of the investigators on a clinical trial for a COVID treatment, and co-founder and co-CEO of Outpeak Labs, a diagnostic imaging company.
Awesome. And Mr. Swift.
Yes, good afternoon, everyone. My name is Reginald Swift, founder and CEO of Rubit's Life Sciences. We are a health research organization that is focusing between product innovation and effective patient outcomes with a lot of data and innovation in between.
Awesome. And I thank all of you for taking the time out of your busy schedule to be here with us today and to share your knowledge and insight. So our first question, and I'll just throw this out there for whoever wants to jump in, is can you explain why COVID-19 is a new virus, but coronavirus is not new? I know when this first started, you would see people post pictures of the Lysol bottle and say, you know, they're saying coronavirus is new. This is not new. It's right here on the Lysol bottle. Can you explain why we're saying this is new, but we have seen the word coronavirus before?
Sure. So I can take this one. But first, let's just talk about what are the coronaviruses. So this is a family of viruses that infect both humans and animals. And when we're talking about the coronavirus now, what we're talking about is the new coronavirus that's causing the disease called COVID-19. So after this explanation, when we just say coronavirus, we'll be talking about the SARS-CoV-2 virus that's causing the disease now. But this is a large family of viruses. There are 7 that have been known to cause disease in humans. 4 of them are just causes of the common cold, and all their names look like license plates, so there's no need to name them. But they're the ones that cause just this stuffy nose, sniffles. They cause more of a nuisance than a problem. And they cause about 1 out of 5 cases of the common cold every winter. So those are 4. And then 3 of them are ones that have caused severe disease. So 2 examples before COVID-19 were SARS in 2002 to 2004 that broke out in the Yunnan province of China, about 100 miles north of Wuhan. That infected around 8,000 people, 700 or so lost their lives. And then in 2012, the MERS virus, which is another coronavirus, 2,000 people infected, 600 died. And now the COVID-19 virus, which has so far affected around 2.3 million people, with 160,000 losing their lives, including 78,000 cases in New Jersey and 3,800 deaths. So it's a large family of viruses, but what we're talking about now is the SARS-CoV-2 virus, which is the disease that causes COVID-19. Another question that always comes up is, since we're familiar with influenza, how is this similar and how is it different than the influenza virus? So it is different. There are some similarities, but influenza is a different virus that causes infection, and it infects maybe 1 to 2 out of 10 people in the United States every year and causes between 20,000 and 60,000 deaths. It is spread in a similar fashion to the coronavirus, mostly droplets and hand to mouth or eye or nose contamination. and it causes a lower respiratory tract infection. So what's called a pneumonia, which can lead to a more severe disease. And the symptoms can be fairly similar: cough, fever, shortness of breath, muscle aches, sometimes a headache. There's a little bit of a difference in that the coronavirus has been causing people to lose sense of taste and smell, which isn't common with the flu. But as far as that goes, the similarities disappear. This is a different virus. First of all, it's deadlier than the flu. The flu is estimated to cause a death in 1 out of every 1,000 people, whereas the numbers kind of move and it's not certain, but we think it's around 1 in 100. So about 10 times more deadly than the flu. In addition, it also spreads easier than the flu. So the flu, on average, if you have an infection, you will spread it to 1.3 people. And there's no such thing as 0.3 of a person, but what that means is that you have 100 people that have the infection with the flu, they will then pass it on to 130 people. So then you'll have 230 people infected. With the coronavirus, this number is 1 to every 2.5 and sometimes even up to 4 people. So we're talking about 100 people that can then spread it to 250 people or even up to 400 people, depending on the conditions. So you can see how it can spread so much more rapidly. It's 10 times more deadly. And this is why it's causing such a strain on the healthcare system. And you see these cases go up so quickly and cause a lot of disease at the same time. So it is a different virus. And in addition, the influenza has a treatment that we can give, and it has a vaccine. And we have trials that are going on, one of them at the University of Virginia. And we have a vaccine that we're trying to develop, but we don't have those yet. So there are some key differences between the coronavirus and influenza.
Awesome. Thank you very much. That was great because I was going to ask that question too, the difference between the two. So you covered both of those for us very, very well. Question about the virus being airborne. Now, if the virus isn't airborne, can you explain why social distancing is so important?
Dr. Essien, you want to take that one?
I'd love to. I mean, I'm trying to learn from Dr. Bell as well, as I did all throughout residency when he was my chief resident, but I'm happy to take this one on. So the data are still, and evidence rather, are really pointing strongly to the new coronavirus being transmitted through droplet, which is by a cough, by a sneeze. That's why social distancing rules are out there, and specifically at 6 feet. That's about as far as these larger, heavier droplets can go. That being said, there's still some data right now that are pointing towards the possibility that this virus might be airborne. There are studies out of China, studies out of Italy, et cetera, that having up to as many as 25% of cases being airborne. Again, I'll let Dr. Bell kind of specify some of those details, but because data are still growing and because of a concern for spread by droplets, again, by cough or by sneezing, but also by speaking. Whenever we speak, every now and then there are some droplets that can get out into the air. That's why social distancing is so critically important. The other point and factor, and I think we might get into this later on, is that as we do a cough, as we do a sneeze, we cough into our hands, we cough into our shoulders, our elbows, etc. We then touch the doorknob, we then touch the windows, the panels, the cell phone, and everything else around us. Again, increasing our risk of potentially being exposed to the virus. So while it's less likely that the virus is airborne, there's still a possibility that that is the case. And the ability to stay away from droplet, whether it's a cough, again, the sneeze, or speaking, is really the big reason why we're recommending that folks stay 6 feet from each other in social distance as is being described.
Right.
And I think it's important to note also is that a lot of this we don't know. Just say it frankly. This is a novel virus, meaning that, and what does novel mean? So coronavirus, Dr. Bell did a great job at explaining the medical end of how we kind of describe it. But for layman's term, I always use that coronavirus is like your last name. Many people have the last name Hilton. We have different strains, different family lines that have different characteristics of each. Still have the same last name, different characteristics. Same thing with the coronavirus. With this virus, though, no one's body has ever seen this strain of coronavirus. And so we are learning new things about the way that it's transmitted. We're learning new things about how long it stays active on surfaces. We're learning new things about how to treat it. And so we're making recommendations based on what we know for now. And so the best practice that we say is to stay as far away as possible. 6 feet is a random number. It's not like we have this randomized controlled trial that says it's 6 feet better than 10 feet better than 4 feet. We're saying just stay as far away as possible from someone so you can prevent the risk of contaminating yourself inadvertently. So,
Great. And along those lines, with the virus living on surfaces, because in the age of social media, we have a lot of things floating around. So they have, it lives for 3 hours on this, it lives, 24 hours on that. Don't pick up your Amazon package until 24 hours later, leave it outside. Like, I disinfect everything that comes into my house. I might actually end up sick from having bleach or Lysol in my food, but I try to wipe everything down because I don't know. And I don't know what's on the surface when I get a delivery. So I spray the outside of the package with Lysol before I open it. I let it sit in the sun for a little while. Do we have any idea or roundabout numbers how long this virus stays on certain surfaces? Or is that all kind of just speculation?
well, we have rough ideas, right? We say roughly for cardboard, 24 hours. We say roughly for plastic and stainless steel, about 3 days. 72 hours, right? The question is how much of a viral load is actually still present on those surfaces. And that's going to vary based on if this was a package that was left outside, right, versus in a contained space. So on average, what we say is that if there's anything that's been handled, just to keep it as simple as possible for everyone that's watching on Facebook, if it's been handled by an outside entity, if you got it from the grocery store, if someone delivered it to your house, we just say before you definitely when you're handling it, to clean the outside surface, and then immediately, regardless if it's been sitting outside for 3 days or not, wash your hands immediately. Treat every surface as if it can potentially be contaminated. And that way you just do, because it's hard to remember, oh, did they say 3 days? Did they say 5 days? I saw on a cruise ship, it said 17 days that it was positive for I think it was the Princess cruise where they tested. They can still see signs of the virus. And that's why, regardless, washing your hands after each and every interaction is going to be the thing that can most safely, keep you safe. So that's the one intervention. So if you don't remember any time, don't worry about it. Just wash your hands.
Okay. Now, if a person believes they've come into contact with the virus, what should they do? I know that there's a lot of confusion of why people are asking people not to go to the emergency room if they believe they may be infected or have symptoms. Why is that not the best practice? And if they shouldn't report directly to the hospital, what should they do?
I can give a quick example, and then I'll ping pong after Dr. Mitchell. But so the way I think about it is like this. If you were to fall and if you were walking down some stairs and you twisted your ankle and you hurt yourself, right? We know that your ankle is hurt. But would you at that point expect to go to the hospital to get a X-ray of your ankle and say, I want you to operate on it immediately? Or would you say, I know I'm injured. I'm going to see how my body can kind of heal itself, right? So for the most part, the vast majority of people that come into contact with COVID-19 are going to be with very mild to no symptoms at all. And what is mild? That can be, very subjective, right? What hurts some people doesn't hurt other people. So mild symptoms meaning a nagging cough. You may have fever, feeling very fatigued, like you have the flu times 100, where you just feel like crap, right? Those people, what we classify as being mild is that your oxygen level is still fine. You're still able to breathe well. Your blood pressure is staying nice and normal. You're not having any signs and symptoms that any organ is being really stretched. You may feel like crap, but your body is still maintaining. So for those people, imagine that's you spraining your ankle, of where we say, sit at home, treat your symptoms, meaning, keep your body as far as your temperature. You can take Tylenol, making sure you note how much Tylenol you're taking. Tylenol is not a medicine that you should freely take. If you get over 4 grams of Tylenol a day, you can do damage to your liver. So read the bottle and take it only as directed. But that being said, If you're not having true difficulty breathing, if you're not having any signs and symptoms that your blood pressure is getting low, like you're about to pass out, or you're having any crushing chest pain, then we say your symptoms can be managed at home. That being said, that does not mean we don't want you to call us. For sure, if anything is bothering you, we want to know. Your doctor should be in touch. If it concerns you, it should also concern us. But we're saying for those people, we don't necessarily want you to come into the hospital, because if you're already fighting off a viral infection, in the hospital, we know bacteria love to live in the hospital, and you can potentially pick up a bacterial infection on top of this viral infection, and then we can have a big problem. So I'll pass it off to Dr. Mitchell to help explain.
Hi, yes. So the question, I'll just repeat it, is basically why you shouldn't initially possibly come into the hospital when you think you may have been exposed or you may have symptoms. So the reason for that is, as she said, what we would like for you to do, let's go over the first directions, is contact your primary care physician. And for those who don't have primary care physicians, you can probably contact your local health department or the emergency room. Then they can direct you specifically, hopefully, to a testing center where you can be scheduled to come in for testing. And this is, as Dr. Hilton said before, if you have mild disease, this is what we want you to do. And because if there is the possibility that you have been exposed, when you go into the hospital, there may be people in the waiting area that you may also expose as well. It's the whole part and why we stress social distancing to begin with. So it's really a process. Yes, we want to see you. Yes, we want to know. And I think for our community, the biggest thing I want to stress is it's not that we don't want you to contact your healthcare provider. We do want you to contact your healthcare provider, because we have a tendency to delay treatment or contact our healthcare providers. We want you to contact them, and hopefully they can direct you to the next step is, whether that's testing or coming into the office and being evaluated for your symptoms. So, Dr. Bell, did you have anything you wanted to add to that?
Yeah, you guys did a really good job already. But the only thing I would add is that if you do need care, seek care. So if your symptoms are so bad that you feel like you can't make it at home, or if you feel like you fell and broke your ankle, we still need you to come in and seek that care. There's a higher bar to come in, because we want to make sure that we're being safe and not preventing the spread and social distancing. But the whole idea of all of what we're doing, social distancing, making sure that we keep hospitals and clinics able to take care of patients, is so that we can take care of COVID patients, but we can also take care of any other need that happens. There's still going to be car crashes. There's still going to be heart attacks. There's still going to be people who regular things happen to. And we need to be able to take care of those people too. So by all means, if you need to be seen, be seen.
Great.
I'll just add also, it seems like Jersey City is in a great place. Like Councilwoman Ridley mentioned, that you have 2 testing sites available. So that's really incredible, where there are so many people, as we know, in particular in our communities, unfortunately, who don't have the primary care doctor they can just call, as many of us are advising. So the opportunity to be able to call not 1 but 2 sites, make an appointment, potentially get tested, is really potentially opening up the health system to be able to receive care. So I think that you guys live in an amazing city that has that opportunity, and would definitely take advantage of that if you can.
Thank you. Now, there is some medical jargon that sometimes confuses people. When we say that people can be carriers and asymptomatic, what exactly does asymptomatic mean? And then at times we'll have people who we say are being monitored or under investigation. And some people hear that and automatically assume that person has tested positive. That's not really what we mean. So can you explain the difference between somebody that's assumed positive, asymptomatic, and under investigation?
Give an example for the asymptomatic that I like to use. So everyone knows of someone who has cold sores, for instance, right? These people carry the virus in their body. You may not see it from day to day, but every now and then that expression of the virus presents itself. So with asymptomatic people with the COVID-19, they may not show any outward physical signs. They may not have the fever. They may not have the cough. They may not have the chest pain or the shortness of breath or the headache or the loss of taste and hearing that we hear people complain of. But they are still carrying the virus inside of them, and they can still pass it off to you. So that's what we mean by asymptomatic. Asymptomatic means without symptoms, but still infected. So anyone else want to piggyback off of the other questions that she was mentioning? But I think that's the one that gets people the most confused of, oh, they look completely fine, so why? Yes, we know of many times of other disease processes where there's no outward sign that anything is going on, but we know that inside of the body, that virus still claims home. So same thing.
This is actually one of the reasons that the virus spreads really well. Because in that phase before people have symptoms or when they have mild symptoms, the virus can spread pretty easily. So you can actually pass it on even if you don't have symptoms. And that's why it's important to stay away from people, because that's protecting you and it's protecting them in case it can spread that way. In the case of SARS and MERS, which were also novel coronaviruses at the time, they were actually more deadly than the COVID-19, but they didn't spread as easily. And one of the reasons was by the time you got sick, that's actually when you started to shed the virus, which means you could pass it on to others. So these people were very, very ill in the hospital, in the clinic, seeking out care. And that's when they started to spread the virus. So there wasn't a long period before where they were able to pass it on. But with the new coronavirus, it's kind of found that sweet spot where it can set up shop in your body and your cells. It can spread to others, and you may not even know that you're sick, or you may have mild symptoms and think it's something else. So that's what made it so dangerous. The other part of that question was about presumed positive and what does that mean? There are a couple of things that we have to consider when we do a test. There are no tests that are 100% perfect. And the way that you test for the coronavirus, at least the way we do it now, is we take a swab, we put it in the back of the throat, through the mouth or through the nose, and we take a sample of your cells to see if there's any virus particle there, so a part of the virus, and then we do a test to see if we can see if it's there. So it depends on a few things. It depends on how much virus might be there in the back of your throat. It depends on how good the nurse or physician is doing the swab to actually get all the way back there. And it depends on what phase of the illness you're in. Because like I said before, if you're in an earlier phase, you may be able to transmit, but you may not have as much virus in your throat. So there are some times when the test may be negative, but we'll say this patient has classic symptoms. And because we're worried, even though it's negative, we might say we're still going to presume it's positive, and we treat as if the patient has COVID disease, even if we can't document that with the test. And that's important because we actually have data and examples out of China where they had patients who were later found to be positive by doing more invasive tests. So, doing a sample really deep down in the lungs that were able to show a positive. But when they checked in the nostrils or in the mouth, those tests were negative. So we've seen documented cases where the tests that we're doing, as good as we can get, can still sometimes be negative. And if the symptoms fit and we want to be very conservative, we might say this person probably still has COVID disease, even if they tested negative.
Okay.
And I think a big point to remember too, so it's one of these situations where we rather presume you're positive and get you isolated so you can potentially not contaminate anyone else than say we don't know and let you go out into the world. What we know is that the way it spreads, to give you an analogy, we're thinking for every one person that gets infected, you have the potential to contaminate or infect up to 4 people. And those 4 people will then have the potential to infect up to 4 more people, right? So by 30 days, that one person, if I was the one infected, I have the potential to infect 1 million people in 30 days. And so when we say you're presumed, we're working on that idea of I would rather treat you as if you are. What we know is despite the fact we tested over 3.6 million people, there's over 300 million Americans. So for every 1 million people in America, we've only tested 10,000. That's not a lot. And so we know we don't have enough tests to say we're going to test everyone. So what we instead say is we're going to presume we're going to presume that you actually do have it, because this one test that I do have available, I need to make sure that if someone walks into the hospital and they cannot breathe, I need to have this test to see, is the reason they can't breathe because of the coronavirus? Is the reason they can't breathe because of a blood clot that went to their lungs? Is the reason they can't breathe because they had a bacterial infection? All those things, different reasons of why you can't breathe, but I have to tailor my interventions based on what's actually causing you not to be able to breathe. And so we reserve those tests because there are only so many tests that we have available. We reserve those for the sickest of people, so we can get them the help that they need. And so that's why we tend to say for other people, if you're, like I said, if you're able to maintain, we say, we presume you are. We just need to we want you to treat yourself as if you are positive. Go home, isolate as much as possible, practice the social distancing, wear the mask in the house if you have one, so that you don't necessarily contaminate everyone else that's in the house, and try to keep yourself to one room as much as possible.
Great. And if we say someone is under investigation or being monitored, that just usually means they're waiting for their test results to come back?
It could be there, because we know there's, especially earlier on, we were waiting for tests to be resulted for over a week, right? Now our testing is getting a little bit better, and maybe Reginald Swift, the founder and CEO of Rubit's LS, can talk about testing on his end of things. But it could be that, yes, we're waiting on a test to come back and result as positive or negative. Or it may be that we haven't offered a test because we don't have one, but you have all the signs and symptoms that suggest that COVID may be likely. Or it may be even this. We know that our tests are not 100% positive, right? We don't have one that is 100% at this point. So there's a margin of error where you could test, it come back negative, but you still have the virus. And so what we say is that if the signs and symptoms are more suggestive that you might possibly have it, we still want you to treat yourself as if you are positive. Keep yourself as isolated as possible, like I said, to try to prevent as much cross-contamination of other people. Okay. Reggie, you want to talk to that?
Yes, absolutely. So when Dr. Hilton is discussing about the rapid test or any type of test, there are several types that are out there now. Some of them are approved through the Emergency Use Act, and some of them aren't, right? We have what you call the cotton swab test, right? You see the long cotton swab, you take it in the back of the throat, you do the viral swab, and you detect a virus strain in the back of the throat. We also have what you call a blood test, or in the medical professional community, immunoassay test. And that is to really detect the antibodies within the blood that have shown that there's an indicator for the COVID-19. And you also have the viral, and you also have some specific areas where people are now trying to do hair sample testing, which not sure how effective that's going to be. But within each of these types of testing mechanisms, you have what they call specificity. And that is to really drive, and that word means for testing, to really identify from a consistency standpoint how accurate that test can actually represent the nature of identifying that viral strain consistently and repeatedly. And that's what is usually done from a laboratory setting. That's usually the type of mechanism to say, yes, this patient is presenting positive symptoms for COVID and is tested positive against the viral strain identified. We also have some of the test methods available where we've actually created a prototype device that can actually detect droplet strains within the air, right? And that is with a mass prototype that we actually created. And that's something that we're looking to really associate with a lot of other groups to really scale up that product to be as effective as possible, because we know that it's a communicable disease, and we want to be sure that we actually have preventative measures to be as specific as possible.
Now, in way of some of the testing and some of the new tests that they're trying to develop, I know that in speaking with my physician, we were discussing possible new tests that I guess they're working on to determine if you have had COVID-19, because there are people who feel like they've had it already, but I don't think at this time we have a test that can tell if you've had it already, and if you've had it, are you now immune? right? Because with the flu,
Yes.
I'm wrong, you can't get the same strand again. But do we know that yet for COVID-19, and are they working on those tests?
So I'm glad that you asked, and I'll let someone else take it after I give my, initial thoughts. So what they're coming up with right now is an antibody test, and that usually, again, as was mentioned before, is the ability to detect any viral strain that was already in the body, right? So right now, it takes a long time to create an antibody, from a person that had it before, right? So what they're also trying to accomplish is not just from an antibody standpoint, but also antigens. Antigens is just kind of a compressed fashion of the viral expression of the antibody factor. To be able to then say, okay, we're going to give it to this person, and then we're going to have either a proof positive or a proof negative to determine if that patient had presented symptoms before or prior to this testing. That's to then give the indication or indicator to say, okay, well, let's test this person again to determine if there is a new strain within the body.
Okay, good. So for our immune system, I know one day I was out shopping and there were quite a few people in the vitamin aisle, and there was this lady and her husband, and she's like, we don't need to get these vitamins. It's not going to stop you from getting coronavirus. And I thought to myself, well, she's somewhat right. But at the same time, don't we want to make sure we're building up our immune system so that if we do get it, we have a better chance of fighting it off? And so should we be taking those steps to make sure we're building our immune system? And with that, what are some vitamins that people should be taking? What are some vitamins and natural substances that boost our immune system?
I'll say this right quick, and then I'll pass it off to Dr. Essien. But if you stay ready, you ain't got to get ready. Meaning that that's just where I'm from. So meaning that we for sure, and I know it's easier said than done. I know it costs $4 to get one avocado, and it costs $10 to get a whole pack of oodles and noodles. I know because that was my life. And so I know it's very easy for us to say, oh, eat healthier. We know this virus kills, but so does poverty. And we know the influx and the impact that that the lack of money and funds can have on vulnerable populations, particularly Black and Brown populations and lower socioeconomic status populations. We know that the food deserts and the food apartheid that happens within Black and Brown communities fully understand that we are asking this vulnerable population to make up for a system that didn't necessarily support them in the first place to eat healthy. So that being said, but it still stands that if you stay ready, you don't have to get ready. So Dr. Essien, what vitamins do you think should be needed?
Yeah, no, that's obviously an important point. And for me, I'll defer to others who may have other vitamin recommendations, but as a primary care doc, I find it very, very challenging to recommend certain vitamins out there because, like Councilwoman Ridley mentioned, there is no preventive cure to coronavirus, the novel coronavirus, COVID-19 or SARS-CoV-2 without the vaccines. So the best thing that you can do for your immune system right now is wash your hands, is social distancing, and to wear that mask so that we can stay out of the hospitals, we can stay out of the health centers, so we can allow folks like Dr. Bell and his colleagues and my colleagues here in the University of Pittsburgh to continue to work on vaccines to help prevent this virus from spreading around our communities. Right now, unfortunately, again, there are no magic pills or magic cures that we can take. Obviously, staying healthy, keeping our hypertension, diabetes, and some of the big chronic risk factors that put our communities at higher risk of dying from this infection is important, but everything we can do, as has been mentioned, to stay safe ourselves and keep our family members and community safe, will continue to help support the health system to develop vaccines to help prevent this disease.
I can add that I'm going to qualify this with I'm not living up to this, but we can all have dreams. But there are certain things that we should do and some things that we should not be doing. So trying to eat healthy, as Dr. Hilton said, is absolutely, absolutely crucial. Trying to increase your consumption of fresh fruits and vegetables. the things that are on the outside of the grocery store, if you go to a grocery store, rather than things that are in the middle of the grocery store. The middle tends to have the processed things and that have high sugar, high salt content. Your fresh fruits and vegetables will be on the edge along with fresh breads. Try to get enough sleep, which I'm trying, but it's important. Your immune system works better when you're well rested. So adults on average will need 7 hours of sleep per night. But you know your own body, and you know if you've gotten enough or not. So getting good sleep is also important. Washing your hands, like Dr. Essien says, is incredibly important. And then the things that we could stop doing that could make our immune system function better. This is a great time to stop smoking if you smoke. And I know from being a primary care physician that it's one of the hardest things for people to quit. But out of China, 8 out of 10 men smoked. And they saw much higher rates of men getting really critically ill from the coronavirus. And they thought it was linked to lung disease that happened when you smoke. So if this is something that concerns you and you're still smoking, it's a good opportunity to stop that. In addition, drinking alcohol in excess suppresses your immune system, and drinking sugary drinks, high salt content foods. So all these things are things that we can do to keep us healthy. Mind you, we're trying, as physicians too, we're probably not living up to all of those standards, but these are what we can do to try to keep ourselves healthier.
And Councilwoman Ridley, I don't know how I missed this. Actually, Dr. Mitchell is a registered dietitian, so I don't know why we didn't go to her first.
It's okay. It's okay. I was waiting to chime in, but Dr. Bell really just hit everything that needed to be said. Is the idea, as you said, Dr. Hilton, is first you need to be as healthy as possible. So if you have any chronic diseases, definitely make sure that those things are controlled and that they are managed properly. The second thing, as Dr. Bell said, is making sure you're getting fresh fruits, vegetables, water, and sleep. Those are really the key things. And I'm going to say this with my nutrition background. There are a lot of vitamin supplements out there. And yes, our body, we need certain amounts, actually smaller amounts that are in a large quantity of the vitamin supplements that are out there. And one of the things we like to say is when people load up on all those vitamins and supplements, they're really just making, if it's water soluble, expensive urine, because most of it is excreted You only need small quantities. If you're eating healthy, then you should get what you need from the foods that you're eating. Now, I'll say all that some people do need additional vitamins out there, and some of those vitamins are required for the immune system and by the immune system, but these supplements are not regulated by the FDA, so there has not been real studies that really shown the efficacy of taking, certain specific amounts. And I tread lightly because yes, some of them are beneficial, specifically vitamin C, vitamin E, and vitamin B6 have been shown to be involved in the immune system, but really hasn't shown to say fight off disease per se. And some of these vitamins can be toxic if you take them in large quantities, specifically your fat soluble vitamins, because they stay within the fat tissue or your adipose tissue longer, where your water soluble vitamins you do excrete. So ideally, to sum it up, eat fresh fruits and vegetables. If you require additional supplementation, please speak with either your physician or a registered dietitian about what you're taking over the counter. Definitely get sleep, because sleep, we know, is known to dampen the immune system. And for my pregnant ladies, please, wash your hands, practice social distancing, and all of those things, because women who are pregnant do have a weaker immune system because they're carrying a child. So do all those necessary things.
Great. I am going to pull 2 quick questions from the Facebook feed, and then I want to segue into our next topic very quickly. I'll go with this one to Dr. Bell. Someone asks, if you have recovered for COVID-19, can you donate blood? And then that made me think of something else that I'll direct to Reginald Swift is, I know that I've seen some people who have recovered that are now donating plasma, right, for a test. Can you explain what that test is? But first, can they donate blood if they have recovered from COVID-19?
Yes, you can donate blood if you have COVID-19. It goes through a regular screening process that's been set up by the Red Cross and other public health agencies. And it's actually something of a lot of interest to researchers and other people interested in treating COVID, because the blood that someone who's recovered from COVID might have enough antibodies to provide protection to someone else who gets sick. So it's absolutely not a reason that you can't donate blood, and it might be something that people are interested in doing. And I'll let Reggie talk about a little bit more of the science behind that.
Oh yeah, thank you, Dr. Bell. So yes, with plasma and patients being able to donate plasma, it's the ability for healthy patients and even those who are kind of recovering to have the platelets form within the sick and the ones who are affected immune system so that they can recover much faster. It's the ability to try and regenerate a lot of the specific cells and a lot of the groupings within the chronic condition to help them recover much faster. So hopefully that's given a little bit of the broad base of understanding why people are doing that. Is to be able to have their antibodies go into their system. I mean, from an antibody from an infected person to a person who is also infected, but also is trying to recover. It's going to help them recover much faster.
Okay.
And to give you a simple, to give you a simple graphic of what I showed my 4-year-old niece. So let's say this is the virus, right? Your body, your immune system produces antibodies. So your white blood cells are your immune system, right? They're the soldiers of your body. They end up producing this thing called an antibody. So let's say the antibody looks in a shape like this, right? And that antibody is supposed to recognize and fit that virus. So every time it sees any component of that virus, your body produces this antibody that says, go connect to that virus so we can get rid of it, right? So what we're doing is when we get blood from someone who has already been infected, their body already saw the virus, so they have a lot of these little antibodies in their bloodstream floating around. We want to say, hey, if you've had that infection, come into the hospital or go into these testing centers of where we can get your blood so we can isolate out these antibodies. So now if someone comes into the hospital who is really, really sick and they have a lot of these little viruses floating around in their body, we can give them your blood that has this antibody that can get that virus and take it away. That's what I told my little 4-year-old niece, Mook Mook, Olivia, who I absolutely love. But that's the way it works. The antibodies is when we're making all these drugs like remdesivir and Plaquenil or hydroxychloroquine that you hear, President Trump talked about. All these drugs, we're trying to basically do what the body is naturally designed to do. We're not as good as the body. We never will be as good as the body. But the body, that's what the antibodies are trying to do. It's trying to rid your body of the virus itself.
Okay.
Thanks.
Great. Now, speaking of President Trump, very quickly before we make our segue, we know that there seems lately to be this new push to open the country, and let's do it very quickly. What is your stance on that, or your recommendation as to when we should get back to normal life? Do you think we are ready?
So
Ready.
I'm sure we all have something to say about this, but let me just take the first stab. I think that we do need to reopen the country at some point because not being able to work and not resuming your normal sort of life, that has an effect too. Mm-hmm. That said, we have to make sure that it's safe. And what we know is that once we do open the country back up, more people are going to get infected because we're not doing as much social distancing. And that's just the way that it's going to work because the virus still is running its course through the country and the world. What you absolutely need is an aggressive and robust testing effort so that you can test people when they have symptoms and isolate them, because what you would expect when you have cases, when they come back up, once we open up the country, we need to be able to test those people, isolate them, and pull them aside and quarantine them, give them the support that they can quarantine if they can't. so that we're prepared for this. I want to go back to a point Dr. Hilton made. We've tested a little over 3.5 million people. There are well more than 300 million people in the country. We tested 1 out of 100, 1% of people. That's as if we tested all of Phoenix, we tested all of Philadelphia, and then for the whole country, we said, because of what's going on in Phoenix and Philadelphia, I know what's going on in the whole country. It's absolutely not enough. Estimates say, public health experts say that we need to do around 500,000 tests per day in order to have a robust enough effort to say that we can safely open up the country and aggressively test people and make sure that we can isolate them. So 500,000 people per day is the recommendation. We've tested 3.5 million so far. So we're nowhere near where we need to get to. And this notion that it can be pushed to the states and they can handle it without an aggressive, coordinated federal effort really frustrates me. But I think the point is, there are certain things we need to have in place to make it safe to open up the country, and we're not quite there yet. And I'll let some of my friends take over. Dr. Hilton, I know you talked about this.
Yeah, right. I mean, to give you an idea, so as you said, there's recommendation we should be testing up to 500,000 a day, and we're right now testing about 140,000 a day. It's not enough. So in order to be as safe as possible, and again, I know the virus kills, so does poverty. I understand the economic strain that has been placed on families. I can't imagine what it's like. I don't have children. I can imagine what it's like to feel like I don't have money to feed them. So I don't take this lightly at all. So I do think we have to work hand in hand, and that's why I'm very glad that you, Congresswoman, are allowing us to have this talk with you, because I think it's going to take policymakers and physicians alike and scientists alike to discuss these to find what's the best, softest spot for us to land, because we do have to do the 3 T's: testing, tracing, and treatment, right? Those are the 3 things that we have to have in place before we can make any move. Testing the person, tracing that person, meaning that once I know that you're positive, I need to know who all have you come into contact within the last 14 days, because I need to be able to test them as well, right? And make sure then all those people, how many people they come into contact these last 14 days. That's the only way we're going to be able to truly get a hold of this. And then the treatment phase is going to be isolation more than anything else. And do we have the resources that if I tell this person, I have to have you in your house for 14 days, then are we providing them with enough food? Are we providing them with the ability to pay their rent and their mortgage, knowing that they're going to be put out in the streets? Are we providing them that if they're a single parent, that someone is going to be able to help them take care of their children, because there's no one else for them? And so I pray for our country. What we know for sure is that this is not, you hear President Trump talking often about a lot of things, but he keeps on making these suggestions of, oh, New York doesn't need all these ventilators. Look, they didn't even have that many sick people. We are still in the middle, very much in the very early stages of this pandemic. We haven't even begun to scratch the surface in many of our counties and many of our states. So we have to figure out a way to support each other in this acute phase so that we can all make it to see 2021 together. So yeah, I don't know if anyone else, Dr. Mitchell or Dr. Essien, you have anything?
I think you guys spoke well on the issue. I feel like every point that was made is how we need to be thinking about it right now.
I just want to say that I think we need to think about this in a more global mindset, because I can honestly tell you the individuals that are rushing to open the country can still work from home and be isolated and don't have to worry about being exposed. If we have another surge, they have the ability to not be exposed and to self-quarantine for longer periods. The people who are going to suffer the most are going to be the people who are economically disadvantaged or don't have access to health care or don't have the ability to stay home for an additional 14 days. These are the people that are going to suffer. So I want to encourage people, if you have concerns about this, you need to contact your local governments and express your concern, because I honestly, as Dr. Hilton and Dr. Bell both said, we are not at a point where we have tested enough people to say that it is okay to open this country back up.
Great.
Yeah.
That's a good segue into our next topic that I'm really going to put on the table and kind of let you guys run with it. But it's COVID-19 and the African American community. We know that recently the Surgeon General made some very public comments about the impact to the African American community. And just as a little background for everyone listening, I was on a phone call a few weeks ago. I posted about it, and I told you that we would set something up, and here it is on a Congressional Black Caucus conference call. And Dr. Hilton was on that call. This was weeks before, the Surgeon General made his statements, and that's no knock to him. He said it when he said it and when he needed to say it, and I thank him for saying that publicly. But Dr. Hilton on that call was discussing the impact that it's going to have on Black and Brown communities because we are at a higher disadvantage. So I want to kind of segue into some of that now and ask, why do you feel the impact would be greater to the minority communities as opposed to other communities?
Right. I mean, it literally was one of those things where the first case of coronavirus here in the United States was documented January 17th. The first death was February 29th. And immediately I knew the Black and Brown people were going to have a problem. Reason being, you hear often that the elderly population and those with chronic conditions are kind of predisposed to dying from the coronavirus. What we know is that hypertension, diabetes, heart disease has set roots into the lower socioeconomic status communities and the Black and Brown communities. What is not talked about, though, and this is what I had a problem with the Surgeon General about, is you can't talk about those conditions without talking about why those conditions live in the Black and Brown community. You can't talk about those conditions without addressing systemic racism and the way that the structure of our communities were designed that way to promote those diseases being prevalent. You can go as far back as the 1930s with the redlining and how Black and Brown communities were etched out, where there were no healthy food options that were placed in the community, that industries were allowed to build their toxic companies where they were spewing, dirty pollution into our air and dirty pollution into our waters. You can't talk about asthma and chronic bronchitis without the influence of those industries on our lungs and our children's lungs development. You can't talk about obesity and diabetes without talking about the fact that in heavily populated Black and Brown communities, there's not even a sidewalk for you to walk around in order to get to have this physical interaction. And so, yes, that's those structures, those systems, even with policing and the longer prison sentencing and the targeting of Black and Brown men and putting them in prison, that's a vulnerable population now that we're saying, oh, we need to watch out for our prisoners. Yeah, you need to watch out for our prisoners, and you also need to stop putting our men in prison in the manner that you are. But that being the case, those are the things that I wish the Surgeon General would have spoken on when he's talking about telling Black and Brown people to be careful, because in certain ways his tone was almost to blame Black and Brown people for having these conditions and not realizing that we're not victims, but we very much are targets in this. And so coronavirus, this idea of racial health disparities is not new. It's not just COVID-19 that's killing Black people at higher rates. Black people have higher death rates for 8 of the 13 leading causes of death. And so this has been a problem that Dr. Mitchell can talk about as far as Black and Brown women dying around pregnancy, that we're burying our children before their first birthday at 2 to 3 times higher rates than any other race. And it's the structural things that we have to kind of address now and after COVID-19 that will help to shift the system so the entire nation can be healthy. Because those essential workers that we are ignoring, the ones that are living in these vulnerable populations, those are the grocery store workers. They're the ones that's working at Walmart and Target. They're the ones that's driving the bus, right? So when we open up this community, Those people that you ignored, that you didn't test, trace, and treat, those people are going to be now the asymptomatic patients are people that are working in the very stores that when the healthcare privilege and the healthcare elite come and get to their supplies for their house, they're going to pick up that virus too. And so we must start to address this. And I don't know if you want to talk about that, Dr. Mitchell, on what you see with your patients.
Of course, I disparities is definitely something that's really big. Maternal mortality in the Black community is a hot topic, and I mean we're still in or just ending Black Maternal Health Week as we speak. So it kind of touches home because I'm a woman, I am a minority, and these are the people that I love to advocate. These are family members. This is family to me. So that's why it matters. And I think it is irresponsible because we're not testing like we should in those communities. And these are going to be the hardest hit communities that are out there. And we all know, even we can take it from a political standpoint or in general health. And I do some research, and I've done research in the past. And what I have seen is you can go by zip code, you can do a geomap and overlay the rates of diabetes, high maternal mortality rate, and high infant mortality rate. And whether it's diabetes, obesity, hypertension, heart disease, all of those things can be seen within a certain community. And it's all by design, because in those places, if you do a little bit more research, you will notice there are food deserts. And for people who don't know what food deserts are, those are places that don't have grocery stores within walking distance. So therefore, they cannot provide fresh food options for people. And then we go back to say, well, why is the rates of obesity so high? Well, they don't have access to great food. They have access to food that is not as healthy. And then you can go into other communities and zip codes, and you will not see some of those unhealthy choices that are present in our communities. And so I think we have to really look at it from the standpoint of a healthy society, and it's eventually going to trickle down to everyone else. Because if you don't have your bus drivers, if you don't have your grocery store workers, if you don't have those people, then how are we really going to open up? Because these are the people that are going to be hit the most.
And I think, we made this call along with the help of Reggie a few weeks ago because, the numbers are important, but ultimately it's personal to us. My mom works at Target. My dad is a bus driver. They're a couple of the most stand-up people I know. They're very proud of what they do. They serve their community in their way, and they're at risk. So the coronavirus doesn't care about these barriers that we erect between ourselves: race, ethnicity, your walk of life, what your family looks like, your color of your skin, what language you speak. Does not care. It just requires that you be a human being. And so we have to respond similarly of breaking down the barriers that we erect between ourselves and make sure that we take care of vulnerable populations, because for the coronavirus, we're all family. So we need to all be family too, and take care of where we need to, where the holes are, get the data, fix the gaps, reverse our disparities, and make it so that, what determines your health is your habits, and not where you live and what you do when the structural barriers that are placed before you. And Dr. Essien, I know you do a lot of work in this area as well too. I'd love to hear your comments.
Yeah, I think everything that's been said already is really thoughtful and incredible. And it's being said. I think the fact of the matter is that I just pulled up this morning my usual search in the medical literature, and today there are 4,600 medical papers written about COVID-19. And this week, the first two that even mention race related to COVID-19 came out. So 2 out of 4,600 essays, papers, research articles, etc., came out about COVID-19. And that's an embarrassment to our field. That is a sign that we are not treating ourselves as family, whether it's the medical journal editors or folks who are in leadership in the health systems in this country. And it's just like I believe it did with maternal health, it's taking the journalists and policymakers like yourself, Councilwoman Ridley, to really call out this issue. And it's taken folks like us, the fact that it is personal for us, the fact that it's affecting our families, our communities. We're not only on the front lines on a day-to-day basis, caring for patients like Dr. Bell and Dr. Hilton in the ICUs or ourselves in primary care settings, but we're also thinking about these data and wondering about our family members. And that's not what it should be like. Like, all of us should be in this fight together. And so I think, again, I applaud you, Councilwoman Ridley, for bringing up this issue in this setting. I'm hoping that other journalists continue to call this issue out, and I'm hoping that we as healthcare providers and researchers, scientists, et cetera, continue to call out our different fields and really make sure that these issues are being emphasized. It's not only one setting. It's not only the Black journalists who should be thinking about this or the Black doctors. All of us should, because that's the only way that we're going to be able to address this issue.
And I'm happy that everyone has provided really valuable insight. Now, for me, coming from a data and a clinical trial standpoint, there are approximately 54 clinical trials right now for COVID-19 across the globe. And there's about 30 or so within the United States. Now, when we're talking about access to care for African American communities, there is one county, and it's in California, that has actually been successful in getting into the remdesivir trial. Well, why is that? Why are we limiting ourselves to say these are the only types of patients that are available to have the ability to access clinical trials? Now, if we're talking about underlying conditions and specific access to health and access to care, we need to be sure that the data that we're putting together, as well as the broader community, as well as like our friends here on this call, that we actually make it actionable to get the types of vaccines that are being created to work on people like us. Not just saying it's a mask for something else to happen. We want to be sure that even if we have underlying conditions, the types of vaccines that are being created take into effect to determine, okay, what's our biological makeup? How can we actually reformulate this vaccine or this antigen or this specific therapeutic effect to have a better outcome for people like us? So hopefully that helps bridge a little bit more of that identity too.
Yeah, and speaking with vaccines, I know that makes a lot of people of color nervous, and rightfully so. If you look at some of our history and some of the tests that were done on African American people, like, I for one am not in a rush to go out and get the vaccine. Honestly speaking. So how I guess, what are ways, or how can we have access to information to make sure that once something is created, it's safe? I know there's talk of a possible Bill Gates vaccine. I don't know how true that is, but how do we kind of do our research to make sure it's safe? And then at the same time, what can we do, those of us in leadership roles, to make sure that our communities have access to those vaccines or, those tests that are being created?
I'll talk about one thing first, and then I'll pass it off to Dr. Bell, or to whoever want to answer. But for sure, so the Black community, I am Black. My name literally means Black. I understand that there is a lack of trust for not only the government but the healthcare system. The history of healthcare, as far as Black people, is horrendous. We know the Tuskegee experiment. If we want to talk about the neglect of Black people, look at Flint, Michigan today with the water supply. I completely understand that, and I completely understand the hesitancy to once you've been hurt, to open that door again. But what I am saying is, when a vaccine becomes available, I'm going to be one of the first people to show up. Meaning, and the reason being is that we see now, we oftentimes have these kind of campaigns of the anti-vaxxers saying, don't vaccinate your kid, don't vaccinate your kid, don't vaccinate your kid. Well, this coronavirus, this COVID-19 has shown us what happens when we don't have a vaccine for one virus, right? This is the widespread of death that we could be seeing. Like I said, last night, I think there was close to 2,500 people that died in the United States. We have to think of ways that we can keep this virus from being as deadly as it was the first time. And what we know currently, 70% of all those dying across the nation are Black people. And we got to wrap our head around that. The fact that if again, based on the system, and it's not Black people's fault, but we're in a system of where our neighborhoods have kind of set us up for these chronic illnesses to be our friend, right? This high blood pressure, diabetes, we got to fight against that, right? But because our body is fighting against that, this virus and this threat of this virus is costing us our life. And we're very much in the early stages of what this thing is going to look like. But I would be hard pressed to say that someone doesn't know someone who has a family member that has either died from coronavirus or came very, very close to dying. And like I said, we don't expect this wave to be over until late into the summertime, if not September, right? So we haven't seen anything yet. So when it comes down to this vaccine, of which we're not going to have a vaccine anytime soon anyway, but I personally want to start this conversation of healing for Black people and working on ways that the healthcare system can earn the trust, because I think that should be earned, but earn the trust of Black and brown people again, because we got to do something to get our people healthier. Anybody else?
Yeah, Dr. Essie and I know what it was like to train in Boston in the Mass General Hospital, and we got the question a lot of time about colleagues taking care of African American patients. They just don't trust what I say, but we came back with, well, there's reason to not trust. And Dr. Essien, you said on NPR maybe 1 or 2 weeks ago that one of the primary issues in the Black community when it comes to medical care is trust, because that trust has been breached many times over and over in our history. And to appropriately address that, you have to make sure that people's concerns are addressed. So we talk about, what are the layers that ensure safety when a vaccine comes out. So any vaccine that becomes marketed in the United States has gone through at least a 3-phase process. The first phase is where a small group of people receive the trial vaccine to just make sure that it's safe. And the second phase is a study that it's expanded to give access to vaccine with more people who have different characteristics, so different ages, different levels of health, different chronic conditions. And then phase 3 is the largest phase, where it's given thousands of people to make sure that it works and that it's safe. And if it goes through that process, then it gets marketed and it can be licensed and sold as a vaccine in the United States. So if the vaccine is available at that point, you can be assured that it's gone through a rigorous process with a lot of controls and patient safety implemented to make sure that it works for people. And as Reggie said, it is important to try to get good representation across the country from different race, ethnicities, so that we can make sure that it does work for everyone.
I just want to lean in and just say a couple of things. One is I really understand, as Dr. Hilton said before, the mistrust that our community has with the medical field. And I understand why, but I do want to encourage people. One, when it comes to medical knowledge, please feel free to look it up and ask your healthcare providers about it. And when we think about resources, please search resources that are validated and that and those resources usually typically on the internet. Everybody has access to the internet. They have cell phones. Please go to websites such as that end in .gov.org so that the information that has been vetted about whether it's vaccine availability or things like that. The second thing is as Dr. Bell said, is building the community, building trust with the medical professions. And I will plug this. This is one reason why diversity in medicine matters, so that people can see our faces and so that they feel comfortable enough to ask us the questions that they need to know to feel comfortable to receive the care that is appropriate for them. Some people don't feel comfortable speaking with their healthcare providers. And I'm a big proponent is you need to find someone that you do feel comfortable with. And I don't care what color, background, nationality that they are. And if it happens to be a person of color and you're a person of color, then I understand that. If it happens to not be, some people prefer women, some people prefer men. But make sure that you feel comfortable with your healthcare provider. And again, that's why I believe diversity is so important in medicine, so that we can begin to heal those bonds. Those things that we have in our community where people are afraid to be involved with the healthcare system.
And Dr. Mitchell, I think you said something very important, which is one of the reasons why I wanted to do this webinar. And I specifically wanted to do it with Black physicians is because, when this thing first started, we would get a lot of people that said, well, people aren't taking it seriously, or, and then a lot of the Black and brown communities, they're not serious. They're still hanging out. They're having cookouts. They're doing whatever. They're posting on social media that Black people can't get it. So I think that having access and speaking with someone that looks like you is very beneficial for a lot of people. So I wanted to kind of put that on display for people to see, people who actually look like them, giving them information in hopes that that would help them pay a little attention.
Yeah, no, this is really great. Yeah. I was going to say, there are 5% of physicians in the country are African American. That is a way downstream solution to preventing the coronavirus. But like Dr. Mitchell said, that is a problem that we have in this country, and that is a solution that we can address both from the preventive standpoint when it gets to the point of vaccination, to the having patients who are enrolled in these treatment trials, vaccine trials, et cetera. So I'm hoping that we address that problem. And just thinking about access, there are, like yourself, a policymaker, thinking and ensuring that our communities, especially in the South, where up to 2/3 of African American people live, have access to medical care, whether that's through insurance or having an actual doctor in place. And so whatever can be done by folks who are maybe listening to this, who are working in that field, before individuals actually get to us and deal with the issues around trust, also need to be addressed.
Okay. I think we've had a great discussion today, and I don't want to hold you too long. We're already at about an hour and a half, and I was like, let's see if we can get this done in an hour. But
not with Dr. Hilton talking. She can hit that 11th hour hard.
If you are viewing online, I know that there are some more questions. I am going to grab those questions. I will send them in an email to our panelists. I'll have them respond to that email, and then I will post those responses on the Facebook live stream directly to you. I'll reply directly to you with those answers. So I just want to thank everyone for joining today. And in closing, I want to give each of you an opportunity to leave some closing words, any advice, or anything you want to get across to the people before we head out. And we'll start with Dr. Hilton.
Oh, man. So I guess the main thing is, Black and brown people, we've always been a sense of community. We've always, there's nothing that's been put in our path that we hadn't had to overcome, and we've managed to not only survive, but to thrive. And this is going to be one of the things that really stretches us and makes us remember to come and lean back in, to say, look out for your neighbors, call people and ask them, how can I be of help? Making sure that every action that you do it thinking, is this worth the life of somebody else? Pick your favorite relative. And if going to that store, if it wouldn't be worth not seeing that person wake up tomorrow, then don't go. But take everything that serious, just until we on the healthcare side of things can get our things in order to take as best care of you as possible.
Great. Dr. Mitchell?
I just want to spread the word that, yes, please continue to practice social distancing at the moment. If you have symptoms, please find your closest testing center and on a human level, as Dr. Hilton said, check in on people. I mean, technology is great nowadays. Look at us now having access to the world via computer or video. Reach out to them via video and check on them, see how they're doing, because this is a stressful time for everyone here in America. Specifically, of course, I have my heart for my ladies that are pregnant or just had babies. Check on them as well. And that's all I want to say. Wash your hands. Wash your hands.
Dr. Essien?
Yes, wash your hands. Please wear a mask if you go outside. Please practice social distancing to the best of your ability. And I would just encourage our members in our community to continue to share their stories. I try to listen, and I think many of us do, to the news every day. And it's the stories from the same individuals who are losing their jobs, who are having trouble homeschooling their kids, and a lot of very millennial and 1%y conversations. But I'm not hearing the conversations around our communities, because our communities are going through it, and they're the ones who are figuring out if their family members are sick. They're the ones who are trying to figure this thing out in a much harder way. And unfortunately, we're missing out on those stories. Obviously, we have patients that we care for, and we can share those, but it's not the same as those who are coming from the emotions that are being felt by your stories. So as best as you can, whether it's on Facebook, on Instagram, on whatever media platform you are willing to or able to, please let us know how you're getting through this so that the world can see how it's affecting our communities in particular.
Awesome. Dr. Bell?
So I'll also say for the first, wash your hands. Important. 20 seconds, alcohol or soap-based solution. There are videos on how to wash your hands properly. But what I really want to leave you all with is thinking ahead, coming out of this. The coronavirus is going to be a guidepost and a turning point in human history for the globe. There's going to be a before this and an after this. My son already is thinking about this as, life before coronavirus and life after coronavirus. So this is going to be something that defines human history. We have the chance here to use the deficiencies that the virus is exposing in our healthcare system, our ability to respond, our ability to take care of vulnerable populations. And that can either be the story of how we let that continue, or it can be the story of how we changed it, how we used this moment to pull together, to unify, and change what was ailing our system so that we can all be happy and healthy and live together. And my hope is that we can use this moment to all pull the same direction, so that when another pandemic happens, or another public health crisis, or even if it's just chronic disease that's affecting the community that is silent to everyone else outside that community, that we said that we use this moment to improve our system and truly take care of each other. And I'm hopeful that we can do that, but it's going to require everyone's help to elevate that conversation, keep it going, and make sure that we hold our leaders accountable, make sure that we're transparent, and that we take care of each other.
Great. And Brother Swift?
Yes, thank you. I share the same sentiments as everyone else on the call. But also what I want to leave with this is that I want people to be able to share their experiences as well. It's not just for their sake, but for us. We're listening. There's innovators like me, and there's physician activists, such as Dr. Hilton and Dr. Bell, and many others on the call and everywhere else that are also listening. They're also watching. They're also are trying to be able to bridge the deficiencies that are on the healthcare continuum as we speak. I'm coming in from an innovative, perspective to really dive into the types of innovations that can be deployed for people like us. And then the continuum of care continues with the healthcare providers, and as well as being the policymakers to have better access to care for everyone else. We're listening. We need to have more information so we can help more people. And the way I'm doing that is being able to be open and honest and be able to kind of overcome what we are facing right now with COVID-19. And this is where it starts.
That's great. Well, thank you so much for all of you joining today, taking time out of your busy schedule to be a panelist, taking time out of your busy schedule to listen in to our great speakers today. And, I just want to put this out there that all of our panelists today, this is, we logged on to Zoom this morning, and this was really their first interaction with me in this live setting. But, you know, I reached out to Dr. Hilton and she said, hey, great, I'll do this Zoom. And I have a group of other physicians and friends who will be willing to do it too. And here's their contact information. And they did not hesitate. And I think that that is a huge deal. I thank you for that because you did not have to do that. So once again, you know, thank you for spending that time with me. If you have any other webinars or any public forums coming up, if you send me that information, I will gladly repost it and share because I'm sure you have tons of new fans after today. And it's great to have access and to see people that look like you sharing valuable information. So I thank you. Thank you to our viewers at home. And to everyone, please enjoy the rest of your weekend. Stay safe. Wash your hands. If you need to contact my office, again, my email address, dridley@jcnj.org. My aide is on the Facebook stream. She made some comments. Kimberly Gokuche. You can definitely reach out to her as well. And thank you. Enjoy the rest of your day.
Take care.
Bye, everyone.
Thank you.
Stay safe.